So I'm Guy Ludbrook, Professor of Anaesthesia here at the Royal Adelaide Hospital and University of Adelaide. Surgery is an emergency. We have a huge emerging situation in surgery where surgery is needed for about a third of all healthcare needs, but it is getting very costly and it's not going to be able to be accessed by many people in the future. We all know about surgical waiting lists, of course. What we don't really appreciate is, as our population gets older and sicker, they spend more time in hospital with complications after surgery. They don't heal as well. That's not good for them or their families. It's not really good for hospitals either, because we need more and more beds, and if they're in hospital not recovering well, we've got a problem. So we need to turn that around. We've certainly suggested that this problem is getting worse at 10% a year, every year, so there'll be 10% less capacity to do surgery every year unless we do something, and we're doing something. So the key focus was we understood that patients who are medium risk, what's medium risk? Getting a bit older, a bit like myself, maybe a bit of high blood pressure, a bit of diabetes, having surgery, and they're going to have more complications. So let's knock that on the head. Let's treat them from the minute they come out of the operating theatre with very intense care, with a lot of doctors and nurses spending a lot of time with them, with a lot of care, protocols, procedures, and looking after them very closely for 24 hours. It's not been done before. People talk about ICUs or intensive cares or HDUs, not particularly meaningful terms. And there's never been any prospective study to look at what their impact is, if any. In fact, most of the evidence suggests they don't do any good at all. We've turned that around and said, let's do a study, let's invest in that sort of care, let's really work hard on these patients for a day after surgery and see what happens. Look, the patients love it. We very carefully ask patients for feedback. And they really like seeing doctors and nurses hovering all around them. You might think you might want a bit of peace and quiet after a surgery. It could be further from the truth. We're finding that patients really appreciate having doctors hovering around them, looking after them, treating them, changing their medicines, and the same for the nurses. And our nursing staff are astonishing at what they do. The most amazing thing we saw was the complications after surgery decreased by 50%. On day 2, 3, 4, 5, 6, 7, 8 and 9, every day. Now that sort of decrease in major complications has never been reported in the literature ever before. So this is a massive change in the quality of care that patients are getting, and the result is seeing the fact they're not getting the sorts of complications that delay their discharge, delay their healing, delaying their return to their homes, loved ones or work. And that really sets up the template or the roadmap for what we need to do in the future. The concern is you write a roadmap and no one ever follows it. That's not always the case, and we've done it. So we read what everyone had decided was the best approach, we put it in place, and we've reaped the rewards, or more importantly, our patients have reaped the rewards.